welcome to the channel. So today in this video we are going to discuss some questions with their brief explanation. So here we have first question is that durability of a tablet to combined effects of shock and abrasion is evaluated by using which parameter, and here we have options are option A is hardness tester, option B is disintegration test apparatus, option C is fibrillator, and option D is screw gauge. So which of the option is correct? So correct answer is fibrillator. Fibrillator is used to evaluate the shock and abrasion. Let's discuss in brief that hardness tester is used to measure the hardness, and a disintegration test apparatus is used for disintegration, and the fibrillator is used to evaluate the shock and abrasion of tablets. It is also used by the fibrillation is done by the Roche fibrillator. So, and screw gauge is also for the hardness. So hence the correct answer is fibrillator. So moving on, next question. Which of the following is excitatory neurotransmitter? So the options are option A is acetylcholine, option B is glutamate, and option C is aspartate, and option D is all of the above. So the correct answer is all of the above, that acetylcholine, glutamate and aspartate is all are the excitatory neurotransmitter. So moving on, next question, that no dihydroguareretic acid is used as, options are option A is preservative, option B is glidant, option C is antioxidant, and option D is colorant. So the correct answer is antioxidant, and NDGA is used as antioxidant. So let's discuss in brief that NDGA is obtained from the Mexican desert plant. The name of Mexican desert plant is Laria divaricata. It is an antioxidant or lipoxygenase inhibitor, as well as inhibitor of peptidoleukotriene biosynthesis. Students, just try to memorize this about the NDGA, and range concentration of is as an antioxidant, that is 0.001 to 0.01% weight by weight. So students, try to memorize these values also. It is used as anti-aging or anti-ache and UV protectant. It's all about NDGA. So the answer is NDGA is used as antioxidant. Moving on, next question. The next question is, on which of the following is the longest railway bridge in India is located? So the options are, option A is Vambanad Lake, option B is river Ganges, option C is river Brahmaputra, option C is Chilka Lake. So the correct answer is Vambanad Lake. Vambanad Lake is the longest railway bridge in India. So moving on, next question is, which is the India's first double-decker train? And here we have options are option A Ahmedabad Mumbai Central Double-Decker Express, option B is Samjhauta Express, option C is Guwahati Tiruvananthapuram Express, option D is Ernakulam Hazrat Nizamuddin Duronto. So as we all know that its name already indicated that the correct answer is Ahmedabad Mumbai Central Double Decker Express. In question, it is the India's first double decker train. So moving on, next question, the two chains of amino acid insulins are held together by, and here we have options are option A is sulfide linkage, option B is hydrogen bonds, option C is ionic bonds, or option D is all of the above. So the correct answer is sulfide linkage. Sulfide linkage is the linker between two chains of amino acids in insulin. So let's discuss in a brief about the insulin. Number of amino acids in insulin is 51, where chain A consists of 21 amino acids or chain B consists of 30 amino acids. So it when total is 51. So the two chains A and B of amino acids are held together by sulfide linkage. That A and B chains are held by a linkage that is of sulfide. So the correct answer is sulfide linkage. So the next question is, autoimmune disease are all of the following except we have to extract that which is not the autoimmune disease, and here we have options are: option A is myasthenia gravis, option B is rheumatoid arthritis, option C is multiple sclerosis, option D is sickle cell anemia. So the correct answer is rheumatoid arthritis. It is not an autoimmune disease. So let's discuss in brief. First, we'll talk about the myasthenia gravis. It is an autoimmune disease disorder in which number of NM receptor is reduced at muscle and plate. Students, it is an autoimmune disease disorder. And in question, the question is that which is not the autoimmune disorder, where rheumatoid arthritis is in which joint inflammation and synovial proliferation and restriction of articular cartilage occurs. It is not an autoimmune disorder. So the correct answer is rheumatoid arthritis. Talking about the multiple sclerosis also, so it is an inflammatory disease in which the fatty myelin sheath around the axons of the brain and the spinal cord are damaged, leading to demyelination and scarring, and where sickle cell anemia is a condition in which there are enough RBCs to carry adequate oxygen throughout your body. So it's all about the disease. So the correct answer is rheumatoid arthritis. Moving on, next question. Drug of choice for cerebral malaria is. So here we have options are: option A is quinine, option B is primaquine, option C is proguanil, option D is pyrimethamine. So the correct answer is quinine. Quinine is the drug of choice for cerebral malaria. So let's discuss in brief that here we have some drugs are there in which we are used. So let's talk about the first. Let's talk about the first about quinine. Quinine is used for cerebral malaria, chloroquine resistant falciparum malaria, where primaquine is used for radical cure of Plasmodium vivax or Plasmodium ovale malaria, or proguanil is used for proguanil always given with combination, where pyrimethamine is used as a drug of choice for toxoplasmosis. Students sometimes or in GPAT question paper that these questions may arise that what is the drug of choice in cerebral malaria or toxoplasmosis. So just try to note down these in your notebook and get revised on time, so it will be better to attempt the question. So next question is, causative organism of diarrhea is, and here we have options are: option A is Shigella, option B is Salmonella, option C is Pseudomonas, and option D is all of the above. So the correct answer is Salmonella is the causative organism of diarrhea. Let's discuss in detail about some other also. That Shigella here we have just given the Shigella, and it is for diarrhea. The causative organism of is abdominal pain and cramps fever, where in Pseudomonas causing lung infection or pneumonia, where in we are talking about the Salmonella, most causally diarrhea occurs. So moving on, next question is selective alpha 1 blocker is, and here we have options are, option A is adrenaline, option B is prazosin, and option C is ephedrine, and option D is atenolol. So the correct answer is prazosin is the selective alpha 1 blocker. Moving on the classification part or explanation from this, that it is a classification of selective alpha 1 or selective alpha 2. So there are selective alpha blocker 1 are prazosin, terazosin, duoxazocin, tamsulosin, alfuzosin, or urapridil, or endormin, where selective alpha 2 are yohibine, idioxazin, rovolsin. So the correct answer is selective alpha 1 blocker is prazosin. So the next question is lyophilization is. So here we have options are removal of water by sublimation, option B is evaporation, option C is drying, and option D is condensation. So the correct answer is removal of water by sublimation. So let's discuss in detail that actually what is lyophilization and what the process include in this. So lyophilization is also known as freeze drying. Students try to just correlate that lyophilization is also known as freeze drying, where or it is in this it is also known as cryo desiccation, in which low temperature process which involves the freezing or at low temperature freezing the product. In this we use just to a low temperature to freeze the product with the help of lowering the pressure, then removing the ice by sublimation. So freeze drying results in high quality product because of the low temperature used in this process. So the original shape of the product is maintained and quality of the re-added product is excellent. So so the correct answer is lyophilization is about the freeze drying. So it's all about the lyophilization. So moving on, next question, that we are having some primary applications of these also, that it is used in biological or biomedical or food processing, or used in also preservations. So these are all are about the lyophilization. Now we are moving on next question, that which is the shortest station name in Indian Railways, and here we have options are, option A is Pune, option B is BC, option C is Goa, and option D is IB. Students, as it's already name, these name indicates that which is the shortest, so the correct answer is option D is IB is the shortest railway station in Indian Railways. So the next question is, which one of these is ex officio member in PCI? So here we have options are, option A is Director General of Health Services, option B is Director Medical Council of India, that is MCI, option C is Registrar State Pharmacy Council, and option D is none of the above. So the correct answer is option A, Director General of Health Service is the ex officio member in Pharmacy Council of India. So let's talk about in detail about the members. So here we have ex officio member table, elected member table, and nominated member table. So first we are talking about the ex officio members. So first is Director General of Medical Health Services, Government of India. And second is Drug Controller General of India. Third is Director of CDL, that is Central Drug Laboratory, which is located in Kolkata. And talking about the elected member, that 6 members of whom at least one teacher of each subject, that is in pharmacy, that is in pharmaceutical chemistry, ecology, cognosy, elected by the UGC, that is University Grant Commission for among us teacher of Indian universities or affiliated colleges imparting diploma or degree in pharmacy, and where one member elected by its member of MCI, Medical Council of India, and one member each elected by the State Pharmacy Council of each state, who should be a registered pharmacist. Students, just try to memorize these about the members, because it is very important. And in it is there a very basic question arises every year from these subjects. So talking about the nominated member, that there are 6 members nominated by the government of India, that is MHFW, Ministry of Health and Family Welfare, from which at least 4 should possess a degree or diploma in pharmacy qualification and should be practicing pharmacy or in pharmaceutical of chemistry, and one representative each of UGC or AICTE, and one member representing each state government or union territory, who shall be registered pharmacist nominated by the respective state government or union territory. This is all about the members, where we just talk about the ex officio members, elected members, and nominated members. So just try to learn them or get revised on time, so it will be more easier to attempt the questions without any confusion. Here we have just mentioned a reference from which it is has been extracted out. So the textbook of forensic pharmacy, Dr. C.K. Kokate, and page number is also mentioned, that is 172. You can take the help from this book to make easier concepts. So next question is, inadequate spreading of coating solution before drying is called as, options are, option A is hazing, option B is blistering, option C is cracking, and option D is orange peel effect. So the correct answer is orange peel effect is happen after inadequate spreading of the coating solution before drying is called as orange peel effect. So let's discuss in detail the defects and their first is hazing. Hazing or dull film or bloom. The cause is, it occur when high processing temperature or cellulose polymer are applied, or if the coated tablets are exposed to high humidity. So the cause is about the case is temperature, it's about polymer, and the third one is humidity. So when blistering occur when due to rapid evaporation from core, and cracking, it occur due to internal stress in the film or exceed the tensile strength of the film, and orange peel effect is occur due to adequate spreading of the solution before drying. As the question arises about the orange peel effect, so it is due to adequate spreading of the solution before drying. So the correct answer is orange peel effect. Moving on, the next or last question, that is ABC system is used for, and the options are, option A is drug control, option B is inventory control, option C is price control, and option D is none. So ABC system is used for the inventory control. The correct answer is inventory control. Let's discuss in detail that how many types of inventory control are. Here we have just it's a table that in inventory control system there are ABC inventory control system, 3-bin system, just-in-time system, outsourcing system, computerized inventory control system, fixed order quantity system, or fixed period ordering. So these are the types of inventory control. So the correct answer is ABC, inventory control system. Let's discuss in also detail about ABC analysis, that in material management, the ABC analysis or selective inventory control is an inventory categorization technique uh, in which ABC analysis divides an inventory into three categories, like A, items with very tight control and accurate records, where in B, items with less tightly control and good records, where C, items with simplest control and simplest control possible and minimal records. So it's all about the ABC analysis. So the correct answer is inventory control. So it's all about the in this video. Thank you.